Hello, hello. Welcome. I'm Dr. Orlando Landrum. One second.
Testing your speakers on StreamYard. Sounds like they're working. Have a great show. Testing your speakers on StreamYard. Sounds like they're working. Have a great show.
Hello, hello. Okay, apparently you guys can hear me. So in this video today, we're going to talk about bone marrow and how it can actually cause more pain than what we really know about or actually think about. If we haven't met, I'm Dr. Orlando Landrum, founder and CEO of Cutting Edge Integrative Pain Centers, and on our YouTube and Facebook channels for Cutting Edge Pain Relief, we help or try to endeavor to help patients understand how to be able to understand different options for your pain and really how to be able to treat it. And today, what we're talking about is something that's called Modic changes. So that's spelled M-O-D-I-C. And so what exactly are Modic changes? Well, sometimes a picture is worth 1,000 words. So I'm going to show you and then explain to you exactly what that means. So this is a picture of the spine. And looking at this spine picture, it can be able to show you that you have these two arrows that are pointing to portions of the vertebral bodies that are different than the others. So if you can see in this particular picture, it's a little bit darker in coloration, right? Versus the lighter coloration of the bone that's either, if you're looking at the lower arrow below it, or the upper arrow that's above it, right? And in between, you can see the disc. So let me take a step away from this for just one quick second. So that's a Modic change type 1. But let's say we were trying to be able to get a better understanding of what that means when we look at it from a model standpoint. So if we're looking at a model, right, this is the bone here, right, vertebral body 1, vertebral body 2, right? And if we're taking a look, in between is that area of the disc, okay? So what we're saying is that there's changes to the bone that's in place, and traditionally it's within the vertebral body itself. It's not a compression fracture. It's not where you've had some degree of arthritis. It's a completely different thing. And it's one of the things that has been not touted as back pain causing, but actually over the last 5 to 10 years really has been looked at as an area that we may have been missing that's causing back pain. So there's 3 different variants or grades, if you would. There's a type 1, like I just showed you, where you can see those color changes that are in place. There's a type 2, where you can see actually it even differentiates even further. And there's a type 3, which you can really be able to see that change that's present within the area of the bone. And I know many people would be like, well, what's causing it? So we're going to talk about that in just a few seconds. But I think kind of the more important sort of bigger picture of all of this is the following, is when we're seeing back pain patients or patients that have pain for whatever reason, many times we try to put them in buckets or classifications of saying, oh, well, you have a meniscal tear, or, you know, from the back, you have a disc bulge, or you have some arthritis that's present. And depending upon the expertise of the doc and whomever else you might be talking to, one of the things that they may be missing out on is an inherent issue with the bone, which very seldom is mentioned. It's mentioned within the context of patients potentially having a cancer problem or issue if you have something like Paget's disease or multiple myeloma. So those type of things are frequently really what is kind of the construct of having an issue with the bone. But normally we're not talking about an issue like this. And actually there's a couple different statements for some of our people who are following us live. Thank you for joining us. We really depend upon and really appreciate your support. For those of you who follow us both live, as well as for those of you who catch us after the live stream. And one of the things that was said was the following, is that type 3 also have a herniation. And interestingly enough, when we take a look at this, it's not just the bone in isolation. Frequently what we're seeing is that there's an interplay between the bone and the disc. So when we start going through some of the slides and information, what that's going to reference is something that's called the end plate. And the end plate is the area where there's contact between the bone and disc. And that's actually what's thought to potentially cause some of these problems and issues with how inflammation spreads. And so again, we're talking about modic changes and how bone can cause potential problems and pain in this context in the spine and in the back. But actually, I'm going to talk to you a little bit further about how there's a corollary in other parts of the skeleton that this may impact. So let's say we took a look at this vertebral body like this, right? Here we can be able to see without the area, there would be a disc that would exist up here. So if we were to invert this and change this and turn this around, we can see this area is what's in contact with the disc. And so that area actually has a number of different things that can influence both the bone as well as the disc and vice versa. And so when we talk about risk factors, these are some of them that can actually be a bit of that can play a role. So if you look in the center, you have that modic changes that's listed, M-O-D-I-C, right? That's how you spell it. And you can see different things that cause it. So as you can see, this sort of pie is broken up into 3 different parts. One that talks about the end plate that I just talked about and disc damage. So if those areas actually have an issue, it may result in disc herniations, as picked out by one of our persons who actually saw that disc herniation in the picture earlier. It can be an end plate defect, which can cause issues, or you can have disc degeneration, meaning that disc as it gets narrower for whatever different reason can cause an issue. In addition, there can be something where you have hyperloading, where you have an increase in terms of mechanical forces. And that could come from a number of different reasons. It could come from that person having an increased weight and obesity. It could because the spine has a different shape and has a deformity that actually distributes that bearing of weight in a different fashion. It could be because you have an occupational load due to how your job has you maybe lifting and things. So there are other causes like systemic factors that can predispose you to having issues like smoking, aging, male gender, and then certain things with genetics that look at different factors that can be a cause. So we're going to give you the resources so you can see these papers at the end where a lot of this information is obtained from. But in one of the papers, I really felt like there was a really good snippet that really summarized not only the patient's perspectives, but I'd probably say maybe 90% of most docs, and that is the following. Is growing evidence suggests that low back pain presents patients with modic changes have a clinically different presentation than low back pain patients without modic changes. And those patients report a greater frequency and duration of back pain episodes, and sometimes they seek care more frequently. At the end of the day, what this suggests is that maybe there's different pain generators, meaning it's not the traditional disc, it's not a disc bulge, it's not an arthritis, it's not a stenosis. And these things are going to respond differently to treatments. And so when patients are treated with conservative therapy, like physical therapy or potentially medications, they sometimes don't get the response that we were hoping for or expecting. And in addition, if they have a surgical intervention where you try to remove the disc or a portion of the disc, it sometimes doesn't work. Well, honestly, that's huge, because if we're using traditional methods to try to treat a problem that's not traditional, it's not going to give us the response that we're hoping for. And we maybe are missing many patients that have pain, but haven't been identified because we're not looking for this type of problem or issue. So that's one of the reasons why we really want to kind of lean into explaining what are modic changes and whether they can be able to be more recognizable, not only by physicians, but also by patients when you review your films. So one of the questions that's posed is can accidents possibly cause this? And it's a possibility, because that trauma component that could give you an issue could cause that. But let's talk a little bit about what does this look like, both from a histological standpoint as well as a cellular standpoint. So histological meaning we're looking at it underneath a microscope, and then cellular, we're going to have kind of a pictorial or graphical representation of all the different factors that really kind of make up for this. So this is a picture that kind of looks at that same type of end plate where you have and that disc joint kind of interface. So if we're going back to that again, it's kind of looking at this, but it's looking at it from a cellular standpoint, where you say, okay, what does this look like if we were to take a look at the bone and we were to take a look at the disc? Okay. So if you were to take a look at this, you can see kind of that normal area from your perspective, probably on the left. And you have a little bit of changes that are present within the area of the disc, and the bone for the most part is normal. But over here, you can see that changes that take place in terms of the bone being less prolific, in terms of the disc having different changes that are present within it, and then you having it replaced with other type of tissue. So we're going to get into what that type of tissue can be, and what does that mean, and how does all of this basically impact your pain and function. So when we take a look at the cellular function, it gets really convoluted very fast. But don't let this picture scare you, because again, we're breaking this down so that it's not the medical fancy terminology on this channel, but for you to understand what's happening with you and why it's happening. So then you can understand the different treatments that might be levied in order to be able to try to bring some improvement in both pain and function. So when we take a look at this, we can see that there's something that's called a trabecular bone. We can see adipocytes, which are fat cells. We can see other hematopoietic type elements, which are going to be things like various components of the bloodstream. So red blood cells, white blood cells, things like that. And then we can see that there's this various mixture of transmitters. So things like IGF-1 or tumor growth factor beta, which this is not cancer. It's an actual factor that we utilize within our body that happens, and how all these different cells talk back and forth that influence the proliferation, not only of blood produced within the construct of bone, but also how that bone can be remodeled, sometimes not for the worse, sometimes not for the best. So when we see all these different changes, what we can see, and the reason why I'm showing you that picture, is when those levels increase of different mediators or transmitters, it may let us be able to identify, one, the process behind how that bone changes in a negative way, but two, also, can we get an idea about, can we see whether this is going to happen earlier or not? If you reference one of our videos, maybe about 2-3 weeks or so ago, that talked about orthopedic biomarkers, where you can identify arthritis before it happens. It's an actually pretty interesting video that could be useful for people. So how can we be able to prevent potential knee replacements and other things if we can be able to identify it sooner? But anyway, getting into this talk about modic changes, one of the things that we can be able to see is, as mentioned for that one question again, is there's an injury that sometimes can take place, sometimes inherently, but sometimes from an outside source, that causes an issue with the end plate. So again, not to kind of belabor this point of going back and forth with this, because I think that viewers are really getting this, but that end plate is, if we're taking a look at this vertebral body and then we're turning it on the inside, so how does it contact that area of the disc? And that disc bone interface really can be hugely influential in terms of these modic changes that can occur. So you have this end plate that results in traditionally in healing response. So if whatever caused the damage seems not to cause any problem, you may be able to get improvement or resolution. But if it doesn't, then you start getting this accumulation of damage, and then you start getting these modic changes that were mentioned earlier, and these changes in the bone. And there's different ways for you to be able to see it, sometimes under MRI, but sometimes these modic changes are really influenced by different things like genetics and other things that can cause you to actually feel that and feel the pain. And so, as you can see, this mentions biomarkers and MRI. Are there ways to be able to potentially identify this sooner than not? So really, there's three main pillars of how modic changes occur and what happens to the bone. So let's talk about what those changes are. So those three pillars are going to be inflammation, bone turnover, and fibrosis. And that is what that damage accumulation results and causes these things to occur. So there are different premises out there about possibly decreasing inflammation, maybe finding ways to decrease bone turnover, and how to prevent fibrosis from occurring. And I think that there's actually even some more elegant ways that exist within regenerative medicine that are really leaning into how can we be able to improve this. And again, why are we talking about modic changes? Because it's possibly a hidden cause of pain that most of the time is being missed. We see a corollary in the other areas of the body, particularly the knee. And in the knee, we see something that's called a bone marrow lesion. We actually had a guest on maybe about 3 months or so ago, Dr. Christopher Williams from Atlanta, who talks about how these bone marrow lesions can cause knee pain when everything else in the knee seems to be normal, where the meniscus is normal, the cartilage is normal, the alignment's normal, and we have this pain that's present, and it just causes an issue. And until that bone marrow lesion is addressed, it frequently doesn't give resolution of the pain. Well, same type of thing could be occurring in the spine, because a bone marrow lesion is very similar to a modic change within the presence of the spine. So let's talk a little bit about what does that really kind of mean. So when we look at something like a chronically damaged disc, it can have leakage and changes and mediators that can occur. There's a lot of them that are present in those white boxes, and we can go through what those things actually are. But at the end of the day, it causes two different results. One is inflammation, and the second is osteoclast activity. So osteoclasts are cells that basically damage, or in essence, they reabsorb the areas of the bone. And that can be a good thing when you're having efficient building up from osteoblastic activity, meaning so the bone turns over the same way as what our skin cells doesn't always stay the same. You slough off some skin and you grow some skin, right? But from a bone standpoint, we have natural turnover. But if you have an increase in osteoclastic activity, what that means in fancy terminology is that you'll have a breakdown of the bone, and you'll also have inflammation at the same time. So I'm sure those of you who have been following have been able to kind of figure out that it's like, well, that doesn't sound good. And you're right, it's not good. It can result in pain that occurs, as well as changes in the spine, which result in differences in function. So let's take a look at some of the different characteristics, as I mentioned before, of a modic change, MC, or bone marrow lesion in the knee. So what you can see is that they are frequently identified under MRI, and the prevalence is actually pretty high clinically than non-clinically. So you can see that there's actually probably more likelihood of it being evident than what we originally believe. Modic changes in bone marrow lesions are mostly painful, and it's in conjunction with that joint degeneration. And we're still kind of figuring out some of this, but that joint degradation and lesions can be actually preemptive of causing some of these problems. So the risk factors, as I mentioned before, are age, gender, specifically male gender, obesity, joint malalignment, smoking, and some of those things can result in having problems and issues that really cause a lot of different resulting pain. So that if you remember that circle, that pie that I mentioned before, It comes from 3 different mechanisms: from an overload of the cartilage, from inflammation, and then some systemic factors that are present. And the natural history is that there are some changes that take place, and within 1 to 3 years, you can be able to have this pain sort of present, typically out of the blue. All right, let's take a look. For those of you who are joining us late, let me just kind of give you a quick update on what's taking place. Basically, we're talking about modic changes and bone. So modic changes are changes in the bone where basically it's taking this osteoclastic activity, meaning so the cells that normally would kind of turn over or resorb bone, and it's taking some of that bone away, but instead of it building back up with traditional bone, it's being substituted with a different substance. So what are some of the resources you can find can give you more information about this? The 2 papers that we use to be able to get some of this information are the following: Pathobiology of Modic Changes, and you can be able to kind of reference this, but it comes from the Department of Orthopedic Surgery at UCSF, which is a really prominent program in medicine. And the second is a paper that looked at how do you look at vertebral end plate bone marrow lesions under MRI. That's from a number of different programs, including UCSF, as well as Hospital for Special Surgery, which is one of my fellowship programs, that looks at how can you be able to assess what's going on with the bone and really be able to understand how this is causing pain. And it's a painful condition that's not prevalent for most people being able to understand. This is back pain that many people just have no idea that is being caused by this particular entity and condition. And so what we really want to be able to do is to have the word be out so we understand it, right? And this is probably a good summation of modic changes, what it means, and how it can be impactful to the person, the patient, or your loved one. So a treatment of modic changes is limited by several factors. First is that there are underappreciated source of pain. That's what I'm trying to tell you. Is there's most docs and many patients don't know what the heck a modic change is. And they don't know that that could be a source of pain outside of it being a disc bulge, outside of it being stenosis, outside of it being arthritis, that this can cause a problem. And how to treat it is even more convoluted. And so as they go on, they say, second is it's unclear as to why modic changes actually cause pain. And there's no consensus at this time for how to treat it. Now, I think that there's some really innovative thoughts. Here, they talk about clinical trials need to be more prevalent. And right now, people are looking at anti-tumor necrosis factor alpha antibodies to be able to see if you can decrease inflammation. They're also using the intradiscal steroid injections by going into the disc. Hopefully, you're able to potentially stop it with steroids. I think there's some other things that should be done instead of that. But be that as it may, what they also make mention of is how can you be able to attenuate or decrease this bone reabsorption and osteoclastic recruitment by using bisphosphonates, which are ways to be able to try to improve overall bone structure. And what we're seeing is that these areas of modic changes mimic bone marrow lesions like we see in the knee that can cause back pain, but cause knee pain, pardon me. But what really needs to be done is further studies really need to be looked at. So this is kind of the, lack of a better way of saying it, cutting edge evaluation of what other pain can exist in different parts of the body that sometimes are missed because we just don't know that this is an actual cause. And one of the papers has a conclusion that really, I think, sums things up in a very succinct way. And that is, modic changes are likely to be more than just a coincidental imaging finding, but rather represent an underlying pathology that should be a target for therapy. So in essence, really, we're doing a disservice to some of our patients by not looking for this more aggressively, seeing that it's causing back pain, and then treating it accordingly. So today we talked about modic changes, how you can have changes in the bone, how it can be resulting from trauma, and how that trauma can then have long-term effects that actually can cause you a problem that sometimes doesn't happen to be identified. Thank you so much for tuning into our channel and continuing to support us. And please, for those of you who join us with regularity, Please send us comments about what else you might want to learn about and how we can be able to help you learn how to be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much and have a great day.